The Seattle Cancer Care Alliance is a unique place because not only do we focus on patient-centered care, but we also have a strong research component so that we can provide our patients with the latest in research and treatments for their cancer. A multidisciplinary approach is really the gold standard of care when it comes to treating patients with cancer. What that means is that the patient's entire team, including surgeons, medical oncologists, radiation oncologists, social workers, genetics teams, and many more, come together in the same space at the same time. This allows us to come up with a customized plan for each patient, and by the end of the day, the patient and every member of their team are all on the same page.
There are a number of studies that have showed that multidisciplinary care is the best approach for colon and rectal cancer. Not only do patients get the latest and most innovative care that is possible, but they have experts in every field discussing their case. The difference between colorectal surgery and general surgery is that colorectal surgeons have completed a residency in general surgery, but then do an additional year of colorectal specific training. We also take a board exam in colon and rectal surgery, so we are not only board certified in general surgery, but colon and rectal surgery as well.
So at the SCCA, we offer several robotic offerings. Robotics is one of the platforms underneath the minimally invasive surgery umbrella. It is designed with extra wristed technology and 3D visualization to hopefully overcome some of the limitations of both laparoscopic and open surgery. It requires extra training and extra level of expertise that both myself and my partners are able to provide to our SCCA patients. However, it is a relatively new technology and it's still being studied. And our goal at the SCCA is to match the right patient with the right technology, because not every patient is right for robotic surgery.
I became a surgeon for a number of reasons, but one of the top ones is that I really value the patient-surgeon relationship. For me, my first meeting with patients is often very intense and sometimes at the lowest point in their lives. They've just been told they have cancer. So to be able to hear what their experience has been, to go through their particular disease process with them, and ultimately to come together and have a plan of how we're going to march forward by the end of that appointment is just an incredible privilege. Ultimately, if we go to the operating room together, the experience being able to remove a cancer from somebody's body and to share that with them and their family and participate is probably the most fulfilling thing I can imagine doing.
Why did I become a surgeon? I started medical school actually wanting to become a primary care physician. I was interested in family medicine, specifically in preventive care, early detection of breast cancer and colon cancer in underserved communities. On one of these medical school rotations, I met a breast surgeon who was screening patients in a mammography van, and seeing her, the way that she spoke with patients as a surgeon, her vested interest in her passion for early detection and preventable disease really sparked my interest that I could contribute in this way as a surgeon. I think early detection of cancer is just as important as treating cancer, if not more important. And being able to offer patients who don't have the resources, the education and information is as much the role of the family doctor as it is of the surgeon who is there to treat the disease when it's too late. So I think being a surgeon allows me to see the full scope of the complexity of the problem and the challenges that patients face when they have to go through their treatments.
So I'm really excited to see increased diversity, both in terms of gender and underrepresented minorities in the surgical field. When I was an intern, I was one of the only women in my class, and so it's really exciting for me to see that there are more and more women entering the field of surgery and gaining leadership roles. We are somewhat unique, although I think it's increasingly becoming more common that we are an all-female surgical team. And I think that there are various benefits that we offer patients, particularly for some of our female patients who may feel more comfortable talking about the intimate nuances or functional outcomes related to surgery.
What does it mean to be part of a female surgical team is a question that I get all too frequently, and I understand why. Medicine, surgery specifically, is very similar to the rest of the country in the sense that most professions are male-dominated. And I think that having an all-female surgical team really reflects the changing landscape in both medicine and surgery specifically. I think the first thing to remember is that we're all surgeons. First and foremost, we've all been through rigorous and prestigious training in order to get to where we are and provide our patients with the best cancer care possible. The fact that we're all females is just icing on the cake and hopefully allows us to be role models for those of us coming below us who want to be surgeons as well.